Welcome back to Soda City Living. We know many of you have been around your family for the past few months, maybe some holiday parties, and just in some tight communal spaces. Well, have you thought about the flu or colds or anything at any point? Well, hopefully you have, and you're taking the necessary precautions to make sure that you are covered. Today, we're here with Dr. Fuchs. She's going to explain to us some ways that we can prevent getting the cold and flu this season, and maybe some symptoms if you think you might have them. So we're so excited to have you joining us today.
Yeah, thanks for having me. I'm super excited to be here.
Absolutely. So first and foremost, the difference between the cold and flu. What is it?
Yeah, that is a great question. So they're both viruses. So we don't use antibiotics or anything to treat the cold or flu. But other than that, it's really hard to tell when you have one versus the other because they do have such similar symptoms. So you really need to be testing. So you can have the cold or flu, and you can have the same exact symptoms. So symptoms would include feeling kind of down, like just blah, blah. Could be fever, a temperature of 100.2 and above, cough, nasal congestion, sore throat. There's so many different symptoms, and it can be the same between the two. So you have lung disease, heart disease. Those things put you at risk for having a worse outcome with the flu. It's really important if you do have what we call comorbidities, meaning those other things going on in your body, that you get to a doctor sooner rather than later if you start having some of these symptoms.
And what are some ways that we can prevent our chances, because it can happen, but how can we minimize our chances of contracting a cold or the flu?
Yeah, so important. I mean, we can, you might get it, but what if we just don't get it? Wouldn't that be great?
It would be wonderful.
So masking, absolutely masking. I know COVID, we were masking a whole bunch, but seriously, the flu incidence went down when we had COVID because everybody was masking. So masking, especially if you have symptoms and you go out in public, washing our hands, using hand sanitizer, and staying home if you feel sick so you're not giving it to others. If you're somebody who's over the age of 65, then I would highly recommend going to see your primary care provider sooner rather than later so that you can be tested for the flu, because there are things that we can do, such as Tamiflu, to help decrease the course of the flu and make your likelihood of going to the hospital even less.
With the flu and cold, how long should you isolate?
Sure, love this question. So really what I recommend and what our CDC is recommending is really 7 days from the onset of symptoms. Cold, that gets a little iffier because it's not as severe as the flu, but that's not to say you couldn't get a cold, your immune system's down, and you end up with the flu on top of that. So really, I would recommend 7 days quarantine if you can. If you're going out, use again, I know I'm harping on this, but please use a mask, wash your hands, hand sanitizer, all those good things. But yeah, I would say about 7 days.
And speaking of overlapping, I know you mentioned overlapping of the cold and the flu. There's also ways people can overlap with COVID as well. And how does that work?
Yeah, so I mean, like anything else, like you can have a heart disease and lung disease, or you can have heart disease and brain disease. You can also have multiple infections at the same time. So same stuff, masking, washing our hands. The more that we can be on top of those things, the more that we can keep ourselves safe and the more we can keep our community safe. Additionally, you can get the flu or a cold, and if you're finding that, okay, I'm getting better, like things are looking good, and then you get worse, that could be indicative of bacterial infection on top of the viral infection. So not only could you have two viruses, but you could have a virus and then get a bacterial pneumonia or something like that on top of the virus. So something else to watch out for.
Now, if there's anyone in the town of Kershaw that is looking for a primary physician, how can they get in touch with you?
That is a great question. Please feel free to call our office. Our front desk staff, Jill or Kayla, would be happy to talk with you and get you in to see me. I'm taking new patients right now, so I'm happy to see anybody.
And when is the best time to get a vaccine for the flu?
Yeah, so you really want to get it before the peak time of flu. So really, in the fall, around October is where we start giving the flu vaccine. If you do it before that, your immunity can wane to it. So then you run the risk like late winter, early spring of getting it. So I tell people October, November, even into December, I would go ahead and go get your flu shots. Really, you want to get it once a year, and you want to get it every year, especially if you're over the age of 18, and really if you're over the age of 65, you want to get that flu shot every year, because every year they come out realizing that, okay, this year I think these strains are going to be what we need to cover. So each year the flu shot's a little different. So you want to make sure you're getting it every single year. Flu shots for kiddos gets a little more complicated because depending on their age, they sometimes need 2 shots in a year. Ugh, I know, more shots. But really talking to their pediatrician or their primary care physician is going to be the best course of action, so they can make sure that they have the immunity that they need and the number of shots that they need.
Dr. Fuchs, thank you so much for joining us. Is there anything else that you'd like our viewers to know about being safe during cold and flu season?
You know, again, mask, mask, mask. Wash your hands. Use the hand sanitizer. I always have hand sanitizer on me, even after I pump gas or whatever. I'm using it because I know I don't want to get sick. I know you don't want to get sick, and I want to make sure that our community stays happy and healthy.
Wonderful and well said. Thank you so much for joining us today and sharing these tips with us.
Yeah, absolutely. I'm happy to be here.
All righty. Well, we are going to take a quick break. We'll be right back with more. We'll continue to have these details on our website, SodaCityLiving.com, along with some of the tips that we got here today. We'll be right back with more right after this.